All right, guys. Can you hear me? Can you guys hear me okay? You can just type in the chat if you can hear me. Okay, perfect. All right, perfect. All right, good. All right, guys. So let's begin, okay? Everyone had you guys have your notes? All right, just let me know when you guys are ready. All right, perfect. All right. So let's go. And you guys can see the screen, okay? All right, so let's go. So we talked last week about health promotion and maintenance. I sent you guys quite a few worksheets to help you through this lecture. It's a very, very difficult lecture. It's hard to teach and it's hard to learn. Okay, so don't feel bad. Just take your time, go slow. Okay. So why are we doing this lecture? So we're stuck here on the aging process. It is very important that we're able to provide care and education for the newborn, the infant, the toddler, preschool, school age, adolescent, adults between the ages of 18 through 64, and then adults between the ages of 65 years and over. So it's very important that we keep that in mind. That's what the board wants from. That's what the NCLEX wants from us. So I can come to you and let you guys know exactly what the NCLEX wants. It's a lot of work, but you can stay focused with these NCSBN test plans. So if you look here where it says aging process, I want you guys to just take a minute when you guys get a chance to score yourself. Like between these bullet points, how would you score yourself? What would you give yourself? A 70%, 80%, not 90%? Score your knowledge, test your knowledge. How well do you know these areas? And if it's anything below like a 75%, this is something that you really want to hone in on. So a lot of the students, they always ask me, okay, where do I begin? Begin with the NCSBN test plan, break it down, and then test yourself. So it's the aging process. We're also going to discuss ante and intrapartum and newborn care, because that's also a part of health promotion and maintenance. Developmental stages and transitions, health promotion and disease prevention. So those are your screenings. And again, health screenings. High risk behaviors, lifestyle choices, self-care, techniques of physical assessment. So there are some techniques you have to know how to do a complete comprehensive health assessment. So it says it here. So you'll understand comprehensive health assessment is very important. All right. So how do you tackle this? I would tackle health promotion and maintenance with note cards. So this, like if you see here, this is the age group. So this is the physical development. This would be my first note card. Make sure that you write down things that you don't know. Don't write the whole book. Just write things down that you absolutely had no idea about the physical development of an infant, or the cognitive stages of an infant, or the psychosocial stages of an infant, the moral development of an infant, age appropriate activities of an infant, health promotion for an infant, vaccinations for an infant, health screenings for an infant, nutrition for an infant, and injury prevention for an infant to 1 year of age. So these are your 10 note cards for this age group. So it just kind of makes it easier. It allows you to break things down because this doesn't go away. All right, so this is on the board. So make sure that you're doing your note cards, put them in your pocket so you can refer to them later. All right, so also you'll do the exact same thing for the toddler, right? You'll do the exact same thing for the toddler. You'll do the exact same thing for the preschooler and the school age, the adolescent, the young adults, middle adult, late adult, old. I put old, and elite old. Some books even discuss elite old. And of course, your pregnant woman. All right, pregnant woman is very important, especially when it comes to injury prevention and nutrition and your health screenings and your vaccinations. So I would do note cards. So in total, if I had to count, so that's 10 note cards per developmental stage. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So 120 note cards. Do it as a group activity. Call your friends, do it with your friends, let them test you. At least you'll feel very confident when you get these questions on the board. All right, so all of this is on the board. This kind of helps you break this down, break all of these things down. The note cards will have all the information that you need on the note cards. All right, and then go back and test yourself after you have your group study. Go back and test yourself and see how well, how much information you retain. All right, so health promotion and maintenance is one of the client needs area on the board. So you definitely don't want to keep getting hit with the same health promotion and maintenance questions. The one thing about health promotion and maintenance that I like is memorization. So that's something that you and a group of friends, you guys could go over this over and over and over again so you can kind of retain some of the information. All right, so let's rock. All right, so let's talk about the cranial nerves first. Remember, we have to discuss the health promotion. We have to discuss health assessment. So we have to know the cranial nerves. So the first thing here is olfactory, and that is difficult to test. You're going to put test here. It's difficult to test with infants. All right. And for children and adolescents, it identifies smells through each nostril. So we all know that the olfactory is smell. It's going to be difficult to test with children, but for children and adolescents, identifies smell. So remember smell. And then you have the optic. So the infant should look at the face and track with eyes. So they should at least track, acknowledge that you're there. And for your child and adolescents, has intact visual acuity, peripheral vision, and color vision. So this is something that you can test with your children and adolescents. For your infant, just remember they should track with eyes. Oculomotor, that's cranial nerve number 3. Blinks. The infant will blink and responds to light. And the pupils should pupils that are reactive to light. Oculomotor has no nystagmus, and perla is intact. So remember perla. Perla is pupils are equal, round, reactive to light, and they accommodate. Pupils equal, round, reactive to light, and accommodate. So trochlear looks at face. So that's cranial nerve number 4 now. Cranial nerve number 4 looks, the infant will look at face and tracks with the eyes. And for our adolescent and teen, has the ability to look down and in with eyes. So trochlear motor, look down. So that's why we take the pen light and we test cranial nerve 3, 4, and 6. We tell the client to look down. Trigeminal, that's cranial nerve number 5. So has, for the infant, rooting reflex. So the rooting and sucking reflex for trigeminal, cranial nerve number 5. And for your children and adolescent, is able to clench teeth, is able to clench the teeth together and detects touches, like detects touch on face with eyes closed. Is able to clench teeth together and detects touch on face with the eyes closed. So cranial nerve number 5. Cranial nerve number 6 is abducens. Looks at face. The infant will look at the face and tracks with the eyes. And remember, is for our adolescent and teenagers, our adolescent and children, the child should be able to move eyes laterally toward the temple. So remember, when we do our cranial nerves, I'm just going to draw here. This is the eye. Remember, we always ask the client to look here, follow the pen light, follow the pen light, follow the pen light. So laterally, they should be able to move their eyes laterally. So that's abducens. Facial, which is number 7, cranial nerve 7, has symmetric facial movements. Has the ability to differentiate between salty and sweet on the tongue. So facial has the ability to differentiate between salty and sweet on the tongue, and they has symmetric facial movements. So cranial nerve 7. Cranial nerve 8, acoustic. So think about acoustic. So the infant should be able to track sound, blinks in response to a loud noise. And for adolescent and children, does not experience vertigo and has intact hearing. Can you guys hear me now? Okay, perfect. RN2, you may have to go in and come, go out, come back in. Okay. Yeah, you may have to go out and come back in. All right. So cranial nerve, glossopharyngeal, has intact gag reflex. So for your infant, you have to check the gag reflex. Has intact gag reflex. And for our child, an adolescent, has an intact gag reflex, is able to taste sour sensations on back of the tongue. So for glossopharyngeal, it has the ability to differentiate. Glossopharyngeal has intact gag reflex, is able to taste sour sensations on back of tongue. Vagus nerves, has no difficulty swallowing. Vagus nerve, remember that's that. So this is 9, we're on 10. Vagus nerve, this is very important here. All right, so for our children and adolescents, speech is clear, no difficulties swallowing, and the uvula is midline. And then the spinal accessory, so that's 11, cranial nerve 11, move shoulders symmetrically. So you have them to shrug the shoulders, and has equal strength of shoulder shrug against examiner's hand. So this is for our infant. They'll move shoulders symmetrically, and has, for our children and our adolescent, has equal strength of shoulder shrug against examiner's hand. And then for our 12th cranial nerve, hypoglossal, has no difficulty swallowing, and open mouth when nares are occluded. So has no difficulty swallowing and open mouth when nares are occluded. For our children and adolescent, has a tongue that is midline, is able to move tongue in all directions with equal strength against tongue blade resistance. So remember, has a tongue that is midline and is able to move tongue in all directions with equal strength against tongue blade resistance. So those are your cranial nerves. So now you may be asking, so when will I ever use them? You have to use them with your patients who are experiencing a stroke, or if you're monitoring a patient who may have had a stroke. So the board wants you to learn them. In my opinion, you guys know I learned the repetition. So what I would do is just make sure that I am going over these things over and over and over again, just, for the board. If nothing else, they want you to know these on the board. It's part of the comprehensive assessment. So you have the recording, you have the worksheet. Just do them over and over again until you really understand them. Okay. All right. So let's talk about deep tendon reflexes. Okay. Deep tendon reflexes. So deep tendon reflex is also a part of the health assessment. So we're talking about infants, we're talking about children, we're talking about our adolescent. So we have to perform deep tendon reflexes throughout the lifespan as nurses. So just pretend that you are a pediatric nurse, or if you're working at a med surg, or if you're working at a assisted living facility, they want you to be responsible for eliciting the deep tendon reflex for all developmental stages. So deep tendon reflexes should demonstrate the following. So partial, A is partial flexion. All right, of the lower arm at the bicep tendon. Now, why did I put this on here? Put NCLEX. One of my students had this question. They wanted her to elicit the reflexes. So that's why I'm giving it to you. So A is partial flexion of the lower arm at the bicep tendon. And then B is partial extension at the lower arm at the tricep tendon. Okay. And then C is partial extension of the lower leg at the patellar tendon. This is the one that we're familiar with, the knee, the patellar tendon. We're all familiar with this. We're all familiar with the patellar tendon. And plantar flexion of the foot at the Achilles tendon. So on the board, they will in fact give you a figure, and they want you to elicit the deep tendon reflexes. So this is a thing. So this is huge. This is NCLEX. Okay. Remember, I talked to plenty of students. When students take the NCLEX, if they pass, they fail, they'll always call me and tell me exactly some of the things that are on, some things that they want me to pass along, or some things to add into my review. They're very nice. So, all right. Let's talk about cerebellar function. Cerebellar function, all right? So cerebellar function, how do we test it with our children and adolescents? So finger to nose, rapid, and it's coordinated movement. So touch your finger to nose, rapid coordinated movement. And for number 3 is heel to shin test. Heel to shin test. So you're testing the cerebellar function by asking the individual to run the heel of one foot down the shin of the other leg while standing. And then 4 is the Romberg test. Able to stand with slight swing while eyes are closed. So that's the Romberg test. And this test is the cerebellar functioning of children and adolescents. Of course, an infant won't be able to do that. All right, so remember your cerebellar function. Remember 2, 3, and 4. All right, so let's talk about physical development now. Fontanelles. So you know fontanelles, NCLEX. Okay, fontanelles. There's another NCLEX point for you. So the posterior fontanelle closes by 2 to 3 months, and the anterior fontanelle closes by 12 to 18 months. So PF, remember posterior is first. Remember PF, posterior is first. Number 7, let's talk about weight. Weight is important when it comes to physical development. All right, we have to know physical development of an infant. So let's talk about weight. Infant gains approximately 1.5 pounds per month during the first 5 months of life. So 1.5 per month during the first 5 months of life. And then the average weight of a 6-month-old infant is 6.6 kilograms, which is 16 kilograms, 16 pounds. So the average weight of a 6-month-old infant is 16 pounds. And birth weight is at least doubled by the age of 5 months and tripled
No.
By the age of 12 months to an average of 21.5 pounds. So 1 year,
Shut up.
21.5 pounds.
That's why I can't hear, because the mic was.
So you have to know, how the progression of the weight. Anything outside of that, anything too low, anything too high, we have to monitor that. 10. Head circumference now. Very important. I want you guys to put NCLEX, believe it or not. Okay, NCLEX. The circumference of infant's head increases approximately 2 centimeters. That's important. Per month during the first 3 months. So the circumference increases 2 centimeters. What if it's not?
It's right.
Okay. And 1 centimeter is 0.4 inches per month from 4 to 6 months. So 0.4 inches per month from the 4th to the 6th month. And approximately 0.2 inches per month during the second 6 months. So head circumference, they will measure the head circumference.
This one here,
all right, let's knock out this chart together. So this is when it comes to your physical development. So most of us, we've had kids, or we may be able to remember, but my daughter is 19, so I don't remember, month by month. So the board wants you to actually be able to identify if a child is having a developmental delay, believe it or not. So they want us to know the gross motor skills and the fine motor skills from 1 month to 12 months. Mm-hmm. So what I would do to kind of memorize this this particular part, which can be very boring, add pictures and just listen to the lecture over and over again. Add pictures. I'm a visual learner. Add pictures and I listen over and over and over again. Okay. Yes. So for the first month, for 1 month old, they will demonstrate head lag.
Screenshot it, right?
And that's gross motor. That's demonstrate head lag. And for a fine motor,
I just heard it.
A 1 month should have a 1 month old has a strong grasp reflex. So when you put your finger in his hand, he should grasp it. He should have a strong grasp reflex. It's a part of the, it's a part of the developmental stages. All right, so remember that. Strong grasp, that's what we want from a 1 month old. So 2 months. Lift head off mattress when prone. That's on stomach. When the baby is on the stomach, he should be able to lift his head off the mattress. And hold hands in an open position, and grasp reflex is now fading. The grasp reflex is now fading. All right. So holds hand in an open position 2 months, and that grasp reflex is now fading. 3 months. Raises head and shoulders off mattress when prone. Only slight head lag now. So now raises head and shoulders off the mattress and only a slight head lag. And for the fine motor, for 3 months, no longer has the grasp reflex and keep hands loosely open. No longer has the grasp reflex and keep hands loosely open. All right. 4 months, rolls from back to side. That's the gross motor, from back to side. And for the fine motor, grabs objects with both hands. That's your fine motor. So you have your gross motor and you have your fine motor. 5 months, rolls from front to back and uses palmar graphs dominantly. So remember, 4th month, it was back to side. Now rolls from 5 months, rolls from front to back. Sixth month, rolls from back to front and holds the bottle now. So that's a big milestone. Holds bottle now. Holds bottle. And then you have your 7th month, bears full weight on feet, sits leaning forward on both hands. Bears weight on feet now. Sits leaning forward on both hands. And then the fine motor skills for a 7-month-old is moves object from hand to hand. Make sure you put this in red for that 7 month. 8th month, sits unsupported. And 8th month, begins using pincer grasp. Pincer grasp. Highlight that, put that in red. It begins at 8 months. That's a huge developmental milestone. That's a huge developmental milestone. All right, 9 months. Pulls to a standing position and creeps on hands and knees. So pulls to a standing position and creeps on hands and knees. And for the fine motor, has a crude pincer grasp. And now you can determine the dominant hand at 9 months. Has a crude pincer grasp and dominant hand preference is evident now. And then 10 month changes from a prone to a sitting position. So that's from on your tummy to sitting now. And they can grasp the rattle by its handle now. $11 month. Now look at this term, cruises. This isn't a term that we normally use, but you have to embrace this term, cruises or walks while holding on to something. So remember this term, cruises, and places objects into a container. And now they have a neat pincer grasp. So start thinking about the toys. And 12 months, sits down from a standing position without assistance. Walks with one hand held. And for that fine motor, tries to build a 2-block tower without success. And they can turn pages in a book. So they tries to build a 2-block tower without success and can turn pages in the book. So this is very important for the NCLEX. Now, the reason why we have to know this is we have to know the normals, because if there's an abnormal, we have to notify the physician right away. So again, for me, guys, I learned through repetition. All right. If you're not fortunate enough to work with this population to see it and to embrace it that way, you have to do this worksheet over and over and over again. All right, let's talk about teeth now. 13. All right. So teeth. All right. We have to think about teeth because we have to teach about cleanliness and going to the dentist. So it starts now. All right. So 6 to 8 teeth should erupt in infant's mouth by the end of the first year. So by the end of the first year, they have 6 to 8 teeth. So 1, 2, 3, 4, 5, 6, 7, 8 teeth by the first year. And the first teeth typically erupt between the ages of 6 to 10 months. Now, here we go. Put NCLEX here. Teething pain can be eased by using frozen teething rings or an ice cube wrapped in a washcloth. So frozen teething rings or an ice cube wrapped in a washcloth. Make sure it's clean. And over-the-counter teething gels are also advised. The teething pain. So with topical anesthetic ointments, absorption rates vary in infants. So therefore, the parents should be advised to apply them correctly, because the absorption rate with those topical anesthetics, they vary. So no one can tell them, oh, it's going to take 30 to 45 minutes. So the absorption rate varies. So just be very mindful of that. And acetaminophen or ibuprofen are appropriate. All right. So acetaminophen and ibuprofen are appropriate if irritability interferes with sleeping and feeding, and they should not be used for more than 3 days. All right. So remember, notice that they didn't mention aspirin. So acetaminophen and ibuprofen. 18. Ibuprofen should be used only in infants over the age of 6 months. Ibuprofen, 6 months. Because remember, these NSAIDs cause GI upset. So ibuprofen over the age of 6 months. 19. Clean infants' teeth using cool, wet washcloth. Very important, using that wet washcloth to clean the teeth because of dental caries. And here we go. This is the NCLEX, okay? Or NCLEX, or if you're taking your exit exam. Here you go. This is your exit also. All right, here you go. Bottles should not be given to infants when they are falling asleep, because prolonged exposure to milk or juice can cause early childhood dental caries. All right, so it says exposure to milk or juice. It didn't say water. Okay. So no milk, no juice. All right, let's talk about the cognitive development, which is Piaget. Piaget sensory motor stage. This is from birth to 24 months or birth to 2 years. This is Piaget. Infants progress from reflexive to simple. So reflex, they progress from reflex to simple, repetitive to imitating activities. So again, 22, infants progress from reflex to simple to imitative activities. So, you know, between birth to 2 years, they'll start imitating mommy or they'll start imitating daddy. So from reflex to simple, repetitive, to imitating activities. And 23, I want you guys to put this in red. Separation, object permanence, and mental representation are 3 important tasks accomplished in this stage. So especially when it comes to object permanence. So object permanence happens between this stage. So now they know, okay, if I put something under the pillow, it's still under the pillow. It didn't disappear. So if I put an object under a pillow, they know in this stage between the later stages, they understand that it's still there. If I put a toy under a pillow, it's still there. So let's go to 25. 24 is an error. 25. Separation. Okay. Infants learn to separate themselves from other objects. And 26 is object permanence. That's huge. Put that in red. Object permanence 26. Put it in red. Object permanence. This process by which infants learn that an object still exists when it is out of view. So they know that the toy is still under the pillow. That's huge, guys. Put NCLEX or put exit next to that. All right. So object permanence. Now, 27. This occurs approximately 9 to 10 months of age. So no more fooling them. They know it's still there. They know it exists. So this occurs approximately 9 to 10 months of age. So if you tell the child, hey, I'm going to get you this toy, and that toy isn't there when they get home, they start to remember. 28, mental representation. Mental representation is the ability to recognize and use symbols. All right. The ability is mental representation. All right, let's talk about language development, which is also huge because you can also pinpoint a developmental delay with language. So crying, 29 is crying, is the first form of verbal communication. And listen to this. Infants cry for 1 to 1.5 hours, 1 to 1.5 hours each day, 1 to 1.5 hours each day, up to 3 weeks of age, and build up to 2 to 4 hours by 6 weeks. So 1 to 1.5 up to 3 weeks, and 2 to 4 hours by 6 weeks. Now, this is important because if the child is crying more or not crying at all, that's the indication to call the physician, the pediatrician. So infants cry 1 to 1.5 each day up to 3 weeks and build up to 2 to 4 by 6 weeks. So we have to know this because 1 to 1.5 is average. If it's more or less, then this is definitely something that it warrants calling the doctor. 31, crying will decrease by 12 weeks of age. 32. Now, here we go. This is NCLEX. 32 is NCLEX. 32 vocalizes with cooing noises. I would suggest you listen to cooing. Right? Vocalizes with cooing noises by 3 to 4 months. 33 shows considerable interest in the environment by 3 months. Turn heads to the sound of a rattle by 3 months. Laughs and squeals by 4 months. Make single vowel sounds by 2 months. And by 3 to 4
he is
months,
on that until
consonants are added.
Oh, okay. And then they say he's supposed to be on the
begin speaking
until the first. I'm gonna have
to
it out. All right. Did they start
word phrases and progresses to 3-word phrases by the age of 1 year.
Oh, the protein. Let me see.
So 38 and 39 are together. They begin speaking 2-word phrases and progresses to 3-word phrases by the age of 1 year. So put 38 and 39 together. So what if the child is not speaking 2-word phrases or 3-word phrases? So this is something that you want to make sure that you let the doctors know.
No, they didn't put it.
All right. This is something that you have to tell the parents
Monday morning
about. And you guys know what's going on in the community now. So this is big. So I want you guys to put this in NCLEX because this is like a red flag if a child isn't saying 3-word phrases by the 1 year. That's a red flag, right?
Oh, I'm just speaking out loud.
I said they stopped giving him the juicing here.
All right.
The what?
Juicing. That was the first.
Let's talk about psychosocial development.
No, they got a different one. It's JPS. I don't know the name.
All right, so psychosocial development. This is Erickson's. You have to remember psychosocial and Erickson. So however many times you have to write it or listen to it, it will be worth it. All right. Erickson stages is a big deal. All right. Psychosocial stages. So Erickson trust versus mistrust. This is from birth to 1 year now.
Oh, okay.
Birth to 1 year. And for 42, achieving this task is based on the quality.
Okay.
There we go. Quality of the caregiver-infant relationship. Okay. So this is based off the care received by the infant. 43 is infant begins to learn delayed gratification. Now, if you're taking your exit exam, this is very important because they learn to trust. They're not going to have a fit as soon as something doesn't happen. They learn to trust. So now they learn delayed gratification. They know, okay, my needs are going to get met one way or the other. They will be met. 44. Failure to learn delayed gratification leads to mistrust. 45. Trust is developed. Now here we go. This is your exit. This is what you will see a lot. Trust is developed by meeting comfort, feeding, stimulation, and caring needs. Mistrust develops if needs are inadequately or inconsistently met, or if needs are continuously met before being vocalized by the infant. So you're supposed to let the infant cue you. The caregiver has to wait for the infant.
Is it bad?
So mistrust can develop if needs are continuously met before being vocalized by the infant.
Hopefully they'll do it. If
Who knew?
Somebody who knows going in and say, hey, because I don't have the energy. I'm sorry.
Right?
No goodness today.
All right. Social development. 47. Social development. Social development. That's huge. All right. Social development is initially influenced by infants' reflexive behaviors and includes they become attached, separation,
you gotta break your neck to make
recognition anxiety, and stranger fear begins now. So now that's social development. So now they're crying when mommy leaves. They're crying when daddy leaves. So social development is initially influenced by infants' reflexive behaviors and includes attachment, separation, recognition anxiety, and stranger fear now. Now they're afraid of this person.
Okay,
Okay, when you say, oh, go to auntie, they start crying. They don't know auntie.
3 weeks ago.
48, attachment is seen when infants begin to bond with their parents. 49, the development is seen within the first month, but actually begins before birth. 50, the process is enhanced when infants and parents are in good health and have positive feeding experiences and receive adequate rest. So this bond is strengthened by mommy and baby being in good health, having positive feeding experiences, and both mommy and baby receiving adequate rest. So that's why the doctors will recommend the mom sleeps when the baby sleeps.
I wonder why this man antibiotic is not
51. Separation, individuation occurs during the first year of life. As infants first distinguish themselves, their primary caregiver, as separate individuals at the same time that object permanence is developing. 51 is a red, goes in red.
I think they
51 goes in red. So 51, separation, individuation occurs during the first year of life, as infant first distinguish themselves and their primary caregivers as separate individuals at the same time that object permanence is developed. So remember that. Object permanence. So 52, separation anxiety begins around 4 to 8 months. 4 to 8. Infants will protest when separated from parents, which can cause anxiety for parents. So it's hard to drop off at daycare because they cry. The babies will start crying. The infants will start crying. And by 11 to 12 months, infants are able to anticipate the mother's imminent departure by watching the behavior. So 11 to 12, they know she's leaving. 11 to 12 months. Stranger fear becomes evident between 6 to 8 months, when infants have the ability to discriminate between familiar and unfamiliar people. And 56 is reactive attachment disorder. So all of this 48 to 55, at the end of the day, this is what we're concerned with. This is something that is not expected. Okay, so this is our one of our chief complaints, or this is what we want the parents to report. So listen to this. It's a reactive attachment disorder results from maladaptive or absent attachment between the infant and primary caregiver and continues through childhood and adulthood. So there's that issue, that reactive attachment disorder. There's an absent attachment between the infant and the primary caregiver, and it continues throughout adulthood.
I'm not gonna deal with that. We're gonna do
so you may hear of this.
Unless we're gonna bring him back right here.
All right, now a biggie. This is huge. I want you to put NCLEX.
He's trying to get out the bed, so we had so we can watch him. Oh, okay.
So age appropriate activities. This is huge. So 57, play should provide interpersonal contact and educational stimulation. So 57 is play. Play should provide that interpersonal. Underline interpersonal and put interpersonal in red, because they love to hit you with the interpersonal versus intrapersonal. So interpersonal contact and educational stimulation. 58. Infants have short attention spans and will not interact with other children during play. So now we have that solitary play. 58 is solitary play. So let's break down the appropriate toys. So this is huge. This is NCLEX. This is where they're going to get you. Right here. This is where you're going to get beat up. So the appropriate toys for an infant. Rattles. A is rattles. B is soft stuff toys. C is teething toys. Teething toys is C. D is nesting toys. E is playing patty cake. Playing patty cake. F is playing with balls. G is reading books. H is mirrors. Believe it or not, mirrors.
I don't know why, because they be popping up on clipboard.
Yeah, but they
I is brightly colored toys. Brightly colored toys. And J is playing with blocks. So let's do health promotion. Care of the newborn after discharge. Care of the newborn after discharge. So newborn infants should be placed in a federally approved car seat at a 45-degree angle. It should be a 45-degree angle, guys. So if this is a 90, a 45-degree angle. Even if you have to draw this on your whiteboard when you're taking your NCLEX, just remember a 45-degree angle. This is a 90, so you want the baby at a 45-degree angle. So this will prevent slumping and airway obstruction.
One time, and
so the car seat is placed rear facing in the rear seat of a vehicle.
I can't work, so I gotta
it
make
should
sure
be rear facing in the
between
back.
the 10th and the
harness should be
13th,
snug.
I guess that's when it's gonna come on.
That means
it's
on the infant, so the infant cannot slip out.
But I'm
and 63, instruct parents that their newborn will require a checkup by the provider with 72 hours of discharge.
Between the 10th and the 15th, 16th.
This is especially important for breastfed
1 month,
newborns.
13th another month.
Breastfed newborns is 64.
All right, have a good.
Because remember the weight.
Okay.
They're evaluating the weight and the hydration status of a breastfed newborn.
So
just a quick timeout. I want to show you guys something. And when it comes to infant and when it comes to injury prevention for infant, the number one thing that they discuss here is injury prevention. That's car seat. You see, car seat safety goes here. That's injury prevention. Car seat safety. And you see nutrition. They have to come back within 72 hours, especially if breastfed. Health screening within 72 hours. They're concerned about the weight.
Oh, yeah.
All right. And then as a child get older, here's the age appropriate activity.
Shoot, I gotta go.
So use your note cards, okay? It kind of breaks things down a lot better, okay?
You gotta do
so let's go back.
I got gas. Yeah, I better lay down.
So health promotion. There you go. Health promotion. Care of the newborn after discharge. 60 through 64. They talk about car seat and they talk about that breastfed newborn. 65. Let's talk about immunizations. Now, for me, guys, there's the only way that I can learn these things is repetition. So listen to this over and over and over again. So birth, 65. Birth, hepatitis B. They're going to get that Hep B. That's very important. They're going to get that Hep B. 66, 2 months. DTaP. B is rotavirus, RV, rotavirus. C is inactivated poliovirus, inactivated poliovirus. D is Haemophilus influenza, so HIB, Haemophilus influenza type B. E is the pneumococcal vaccine, which is PCV, pneumococcal vaccine, and I put Hep B twice. So that's 2 months. 4 months, they have to get the DTaP, RV, which is rotavirus, IPV, inactivated poliovirus. D, Haemophilus influenza type B, and PCV is the pneumococcal vaccine. That's 4 months. 6 months, DTaP, inactivated poliovirus, pneumococcal vaccine, Hep B, rotavirus, Haemophilus influenza type B. Six to 12 months, they have to have the seasonal influenza vaccination yearly. Seasonal influenza vaccination yearly. All right, let's talk about nutrition, which is also a big deal. It's huge for us. We have to be able to teach the mother about nutrition. Okay, we have to know there's different nutritional needs for every developmental stage. So as nurses, we are responsible for them. And guys, just remember your vaccine. You may get a question on vaccines, especially when it comes to this Hep B. Okay, especially when it comes to that Hep B. All right, nutrition. Breastfeeding provides a complete diet for infants during the first 6 months. Underline the first 6 months. It's a complete diet. Breastfeeding for 6 months. So 71, iron fortified formula. Iron fortified formula is an acceptable alternative to breast milk. Remember, iron fortified formula. 72, cow's milk is not recommended. 73, it is recommended to begin vitamin D supplements within the first few days of life to prevent rickets and vitamin D deficiency.
Ooh, I better close it down.
So you guys will see, like in the iron fortified formulas, now they have the vitamin D rich iron fortified formulas because prevents rickets. 74 is iron supplements are recommended for breastfed infants. Iron supplements. Alternative sources of fluid, juice or water are not needed for the first 4 months of life. That's huge, guys. All right, put 75 in red. 76, excessive intake of water could result in hyponatremia. That's low sodium, hyponatremia, and water intoxication. So for the first 4 to 6, for the first 4 months of life, it's not needed. They don't want to risk hyponatremia. So remember that. 77, after the age of 6 months, then the 100% fruit juice should be limited to 4 to 6 ounces per day. So just think of like a soda can is what? A soda can is 8 ounces. 78, solids are introduced around 6 months of age, solids. And 79, indicators for readiness includes interest in solid foods, voluntary control of the head and trunk, and disappearance of the extrusion reflex. So that's the tongue thrust reflex is gone. So how do I know that they're ready for solid foods? They have control over their head, they have control over their trunk, and that tongue thrust reflex is gone. 80. Iron fortified cereal is typically introduced first due to its high iron content. New foods should be introduced, this is huge, one at a time over a 5 to 7 day period to observe for manifestations of allergy or intolerance, which might include fussiness, rash, vomiting, diarrhea, constipation. So one solid food or one new food at a time. And I want you guys to underline fussiness. Like even as an adult, if you see an adult client who is restless, you kind of can determine something is going wrong. So fussiness, rashes, vomiting, diarrhea, constipation, that's an indication of an allergy. So you want to introduce one food at a time. 82, vegetables or fruits are started first between 6 to 8 months. And after both have been introduced, meats may be added. So first the vegetables, first the fruit, and then meat. Citrus fruits, meats, eggs are not started until after 6 months of age. Now this is huge. 85. Breast milk should be decreased as intake of solid foods increase, but should remain the primary source of nutrition through the first year. So breast milk is the best milk. So for the first year. Table foods that are well cooked, chopped, and unseasoned are appropriate by 1 year of age. So well cooked, chopped. So well cooked means soft to prevent aspiration. All right. Chopped because we're thinking about choking. So here we go. 87. NCLEX because of injury prevention. Safety now. So 87 is huge. So appropriate finger food. Here we go. It includes ripe bananas, right? Bananas, toasted strips. So toast, cut it up, toasted strips, graham crackers, because they melt, they dissolve. Graham crackers, cheese cubes, small cubes, cheese cubes are appropriate. Noodles are appropriate. And firmly cooked vegetables, meaning they're soft because we're worried about aspiration. So firmly cooked vegetables and raw pieces of fruit, but no grapes. No grapes. Okay. So again, appropriate finger foods include ripe bananas, toasted strips, graham crackers, cheese cubes, noodles, firmly cooked vegetables, raw pieces of fruit, no grapes. Weaning can be accomplished when infants show signs of readiness and are able to drink from a cup, sometimes in 6 months. 6 months. and gradually replace one bottle or breastfeeding at a time with breast milk or formula in a cup with handles. Make sure you give those handles, because remember about gross motor movement. So handles. And bedtime feedings are the last to be stopped. So for injury prevention, guys, you have to know about if I had to take anything, like if I were in a crunch, I would definitely memorize or further study my appropriate finger foods. All right, let's talk about sleep and rest. All right, sleep and rest. This is huge. I sent you guys a worksheet on sleep and rest. Nocturnal sleep patterns is established by 3 to 4 months of age. That's 3 to 4 months. Infants sleep 14 to 15 hours a day, right? And 9 to 11 hours at night. All right, around the age of 4 months. So 14 to 15 hours daily, 9 to 11 at night. Infants sleep through the night and take 1 to 2 naps during the day by the age of 12 months. So they take 1 to 2 naps during the day by the age of 12 months. So they should sleep through the night. 93 is sleep through the night. Injury prevention. This is us. We specialize in injury prevention. Remember, safety. So 94, aspiration. We're trying to prevent aspiration of foreign objects. So hold the infant for feeding and do not prop bottles. We don't prop bottles. Small objects that can become lodged in the throat. So we try to avoid grapes, no hard candy, and no coins. So grapes, candy, coins should be avoided because small objects can become lodged in the throat. Age-appropriate toys should be provided. Age-appropriate toys. And 98, clothing should be checked for safety hazards, like loose buttons. If there's loose buttons, that's a safety hazard. Bodily harm. Remember safety. This is us. This is what we're afraid of. Sharp objects should be kept out of reach. Anchor heavy objects and furniture so they cannot be overturned and fall on top of the infant. So anchor the heavy objects, and infants should not be left unattended with any animals present. Any animals present. Do not leave the infant unattended. Let's talk about burns. For the formula in a microwave. Avoid warming the formula in a microwave. The temperature of a bath should be checked. Hot water thermostat should be set at or below 49 degrees Celsius, which is, believe it or not, 120 degrees Fahrenheit. Working smoke detectors should be kept in the home. Working smoke detectors. Handles of pots and pans should be kept turned to the back of the stove. And sunscreen should be used when the infants are exposed to the sun. And electrical outlets should be covered. Drowning. How do we prevent drowning? Infants should not be left unattended in a bathtub or around water sources. So they shouldn't be left around toilets, cleaning buckets. They shouldn't be left around drainage areas. So infants should not be left unattended in bathtubs. 110, secure fencing around swimming pool. So secure fencing around swimming pools and close the bathroom doors. That's how we prevent drowning. Let's talk about falls. Crib mattresses should be kept in the lowest position possible with the rails all the way up. Lowest position possible. 113. Restraints should be used in infant car seats. It prevents falls. And 114. Infant seats should be placed on the ground or floor if used outside of the car. They should not be left unattended or on elevated surfaces. Don't put the car seat on elevated surfaces. Don't put the car seat on the top of the car. Place safety gates at the top and bottom of the stairs. Place safety gates at the top and bottom of the stairs. Poisonings. 116. Exposure to lead paint should be avoided. So lead paint, it causes neurological issues. Toxins, like cleaning products, and plants should be kept out of reach. 118. Safety locks should be kept on cabinets that contain cleaners and household chemicals. So safety locks. And 119, which is huge. I want you to circle 119. The phone number for poison control center should be kept near the phone. So if you have an infant, if you have a child, you have to have the poison control number kept near the phone. Medication should be kept in child-proof containers. And huge, this is NCLEX 121. It's NCLEX. A working carbon monoxide detector should be kept in the home. A working carbon monoxide detector. And it should be, you should check it every 6 months. Q 6 months, every 6 months. Motor vehicle injuries, guys. This is car seat safety. Put car seat safety. Car seat safety. That's huge, 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 huge. Car seat safety. That is huge. All right. So 122 to 126 is fair game. All right. They love the car seat safety. So infant 122 is infant only. And convertible infant toddler car seats are available. So infant only. Infant only. Infants and toddlers remain in a rear-facing car seat until the age of 2 years old. 2. And the safest area for infants and children is the back seat of the car. The rear back seat of the car is the safest for infants and children. Do not place rear-facing car seats in the front seat, because vehicles have those passenger airbags. So do not place rear-facing car seats in the front seat. An infant should not be left in parked cars. Parked cars. Suffocation. Remember, safety and injury prevention. So injury prevention, suffocation. Plastic bags should be avoided. Plastic bags. Balloons should be kept away from infants. Balloons. That's why some of these places like Chuck E. Cheese, you can't even bring balloons to a party. Balloons should be kept away from infants. Crib mattresses should fit snugly. They should be tight. Mattresses, snugly, tight. And 130 is NCLEX. 130. Crib slate should be no further apart than 6 millimeters. That is 2.4 inches, approximately 2.4 inches. So 2.4 inches. Crib slate should be no further apart than 2.4 inches. Think about how the infant head grows month to month. So 2.4 inches, they're not going to get their head through that. Crib mobiles and crib gems should be removed by 4 to 5 months. After 4 to 5 months, they become a safety hazard. Crib mobiles, crib gems should be removed. And pillows should be kept out of the crib. Infants should be placed on their backs for sleep. And toys with small parts should be kept out of reach. Toys with small parts should be kept out of reach. And drawstrings should be removed from jackets and other clothing. Drawstrings, because they can get their necks, or they can get entangled in the drawstrings. So drawstrings to avoid, suffocation. All right, guys, that is it. So tomorrow we'll meet again at 2 and we'll knock out part 3. All right. I'll see you guys tomorrow. I'll send you guys part 3. All right. We're rolling, guys. Keep it up. Do your note cards, okay? Do your note cards. All right, guys. See you tomorrow.